4 o'clock news. My name is Noah Hicks, and today we'll be talking about diabetes and how it is on the rise in El Paso. Look out for, if you may think you have diabetes, are tingling in the hands and feet, an increase in urination, an increase in thirst, an increase in hunger, possible weight gain, and chronic fatigue. And if you do think that you have any of these symptoms or experience any of them, please don't hesitate to call your provider and go ahead and get checked out. This is Noah Hicks with the evening news. Go ahead and flip back at 6 o'clock for our show on gardening owls. Good gardening or evil poison?
Mom! I just heard that in the news that they're talking about diabetes and I have all the symptoms.
Well, what are the symptoms?
I have frequent urination. I'm always hungry. I even wake up to go get food like at 3 in the morning.
Oh my goodness.
And I've been drinking a whole lot of water. I just drank a whole gallon of water and I'm still thirsty.
Oh my god.
So they said that those are the main symptoms for diabetes. So should I go get checked?
Yeah, we should schedule you an appointment with your doctor.
Okay, I'll make it right away. Hi.
Hi, how can I help you guys?
We're here to see the doctor.
Okay, can I have your name and date of birth, please?
Yes, it's Jasmine, and then my date of birth is 8/10, 1985.
Okay, perfect. Is it okay if I just take your temperature real quick? Okay, and then you as well. Okay, perfect. If you could just go ahead and fill this out for me, please.
Okay.
And then we'll be right with you.
Okay, sounds good.
Thank you.
Thank you.
Hello, my name is Emma. I'm going to be your tech for today.
Hi, Miss Emma.
Can I have your name and your date of birth?
Yes, it's Jasmine, and my date of birth is 8/10, 1985.
And you? Christina.
I'm her mom.
You're her mom? Oh, okay. What brings you guys in today?
Well, I'm having a lot of thirst. I've been hungry, hungry all the time. And then I've been feeling very fatigued.
Okay. And your blood pressure is 120/80. Seems good. I'll go ahead and let the nurse know, and then I'll go ahead and let her know, and so that way she can come inside. Okay.
Okay, sounds great.
See you soon.
Thank you.
Come in.
Hello, good afternoon.
Hi.
My name is Pedro. I'll be your nurse today. So the CNA tells me you're here with symptoms of diabetes.
Yes.
Can you elaborate more on that?
Well, lately I've been very thirsty. I've drank like maybe 2 gallons of water a day.
Okay.
I eat like 3 times a day, but lately I've been getting up. Like I wake up because I'm so hungry.
Okay.
And also I've been urinating a lot. At first I thought because, well, I drink a lot of water, but it's just too much.
Okay. So you're urinating a lot, you're eating a lot, you feel thirsty all the
And
time.
then also I'm getting blurred vision.
I was gonna say, so you are having trouble with your vision?
Yes.
What about numbness and tingling to the hands? Are you experiencing a little bit of that?
A little bit, but to me I thought because I'm probably like on it, like, you know, sometimes I sleep wrong, but I've been noticing that they feel like little needles on the tips of my fingernails.
Pins and needles?
Yes.
What about any confusion? Are you having any problems at work? Have you noticed?
No, just a little fatigue, but nothing more than ordinary. I do have a little bit harder time to wake up in the morning, but besides that, no.
Okay, and then how's the diet?
I do eat healthy when I'm at home, but on the weekends we tend to go to, Hot Guys or, Mickey D's or, but during the week we do eat healthy.
Do you have a family history of diabetes?
Do we, Mom?
Your dad actually had diabetes,
Okay, so it does run in the family.
and he recently passed away from totally unrelated cause.
Okay, well it does sound like you have all the signs and symptoms. We can go ahead and check your blood sugar just to verify real quick, but I'm going to go talk to the NP, relay that information, and he'll come in and he'll do his evaluation.
Okay.
Anything else?
No.
No? Okay.
I'm not gonna die, am I?
No.
No.
Hello.
Hi.
The nurse wanted me to come take your blood sugar, okay?
Okay.
So, I'm gonna clean you with alcohol, and swipe it with a clean cotton. Then you're gonna feel a little poke.
Okay.
Alright. Okay, and here's a little
Band-Aid?
Band-Aid, yes. Okay. Okay, it's reading at 210, okay? I'm gonna go ahead and let the nurse know and then they'll be in to see you, okay?
Is that okay or is that bad?
That's actually a little high, but I'll let the nurse explain everything to you, okay?
Okay, sounds good. Thank you.
Dr. Carbacoa, I have Miss Flores, 30-year-old female, Hispanic from El Paso, Texas. She reported with signs and symptoms of diabetes, increased urination, frequent thirst, occasional blurry vision, occasional neuropathy. We had her blood glucose taken, and it was at 210. So she's showing all the signs and symptoms. I do think she has diabetes.
Okay.
Sure.
Hi, I'm Dr. Carpova. How are you today?
Good, and yourself?
I'm doing all right. So I was told you came in because you're worried you might have diabetes.
Yes.
So they went ahead and took your blood sugar, and yes, it looks like you do have indications of diabetes because your blood sugar was around 210. So the way diabetes works in the body is that you will become what's called insulin resistant. You have type 2 diabetes. So over time, your body just becomes almost immune to the effect of insulin, and so it doesn't do its job in the blood, where it comes in and bind to the cell so that it can open, and the glucose in your sugar in your blood can go into the cell and give it the energy it needs. But over time, the cells aren't able to bind to insulin. So we have to give you more insulin or give you medications that can help with that process. It's a very common thing, especially in El Paso amongst Hispanics. So it's nothing you really have to worry about. It's a perfectly manageable disease. And we'll come and we'll teach you how to mix your insulin, and Pedro will come in later and give you your shot.
Okay.
Do you have any questions?
I have lots of questions. Like you said, you'll educate me through, right, and make sure that I can control it and manage it and.
Yeah. It's very easy, very simple once you get the routine down. And there are a lot of different medications to have to worry about mixing, but once you get into the rhythm, it's very manageable. And a lot of people live with this disease.
Will you give me any extra information so I can take home and?
Yeah, we'll give you some discharge papers with plenty of information, and then the pharmacy will also give you some papers. And you'll be coming back to the clinic on a weekly basis so that you can learn how to do this, and we'll be with you every step of the way.
Is there anything that she should look out for as far as
So
if it gets too
on the
high?
discharge paper, we'll be giving you signs and symptoms of hyper and hypoglycemia, what happens when your blood sugar gets too low, what happens when it gets too high, and there will be dietary recommendations. So you want to avoid certain foods like pastas and carbs when you're getting a little too high, and of course sugar and candy will not help, but certain vegetables like broccoli and leafy greens will help with diabetes as well. So it's a lot of dietary management, and then also increase your activity, start going to the gym a little more, like 2 or 3 times a week, go for daily walks, just stay active. And you're a little young to be getting diabetes, but it's not uncommon for 30-year-olds to be getting this condition as well. So I'll go and let Pedro know that you're ready for your shot, and he'll come in and administer it, and then give you the discharge papers, and we'll see you next week.
Let's see, how can I help you?
Hi, my doctor placed a prescription. I was wondering when I can go pick that up.
Name and date of birth, please.
Jasmine Flores, December 1st, 1994.
And the order? What's that? The order?
I think it was insulin. He didn't tell me which one.
Okay, here I see the here I see the Novalox and the NPH.
Yeah, that sounds about right.
Okay, it's gonna be just come back in 2 hours.
Okay.
Let us.
I'm in denial. I don't have anything. You're wrong.
I'm wrong?
Yes.
Alright, well, the doctor did order some insulin right now. 4 units of fast-acting Novolog, which is going to bring your levels down within the next 15 minutes. With 15 units of MPH to hold you over till tomorrow, till you can get your insulin from the pharmacy. We'll have you come back tomorrow if you can, and I'll show you how to inject yourself as well as monitor your blood glucose with the finger sticks.
And I gotta inject myself all the time?
Yes, multiple times a day. Anytime it's elevated, which is going to be after meals, you're going to have to see how high, and then.
And then I miss it?
If you miss it, you run the risk of running hyperglycemic, and that's dangerous to your health.
And I could die.
Yeah, eventually, yes, you can, if it's not controlled.
This is crazy, Mom. You shouldn't have came.
You're not. No, you're not the first person. You're not the last person. It is very common in our community because of our diets, but it's very manageable.
Okay.
It's just something you're gonna have to get used to.
Okay.
But right now, I'm gonna go ahead and administer the insulin he did order, and this is administered either in the abdomen or behind the arm, where
Okay.
there's fatty sites. So if you have a preference for the arm right now,
Yeah, I guess. just-
you're right.
yeah.
Okay. So we'll go ahead and clean it
No more cheating weekends.
and administer. All right.
You're gonna starve. You're gonna kill me with starvation.
Oh, you won't be starving.
So I can't tell you not to eat those ever again. We're human, we have cravings, but it's one of those things we're gonna have to do in moderation. So every now and then it is okay to go ahead and enjoy something, but you have to have your blood sugar in the back of your mind. So you have to have your insulin on you and your glucometer on you just to make sure it doesn't get too high.
Okay.
Do you have any more questions?
Anything? No.
No?
Oh, what can we do if it happens to drop too low?
Too low? So that's a really good point. You should always carry some type of high sugar snack on your person, whether it's a Reese's Pieces or they sell little glucose cubes you could buy,
Oh,
and it's exactly I think like 15 grams of sugar, in case it gets too low. Because too low is also bad. You do need sugar in your cells.
But it would
to-
get low if I take the medication, right? Because you're telling me
It
that
could.
it's-
It could. So with the Novolog, which is the fast-acting one we just gave you, you have to make sure you do eat after this one because it's pretty rapid onset. It's within 15 minutes.
Okay.
So if you're gonna eat, you need to take this, but you need to make sure you eat. Otherwise, you will go hypoglycemic.
Okay.
Any other questions?
Am I gonna get all this written down, right? Because I'm not
Yes.